Iowa Agribusiness Radio Network, and we have a special guest joining us here today, and it is medical advisor to the president, Dr. Anthony Fauci. Dr. Fauci, thank you so much for joining us today.
Thank you for having me. It's good to be with you.
So obviously our audience here is usually rural Americans and farmers and things like that. Tell us about what kind of trends we're seeing in rural America. We hear so much about what goes on in the big urban centers, but what are we seeing in rural America?
Well, what has happened, not only with this variant, but also with the Delta variant, we're dealing with an Omicron variant right now, which is a highly transmissible virus, which has gone in a very, very steep incline in the big cities. It goes up acutely, and it's starting even in New York City to come back down a bit. In the rural areas, such as your listeners and your viewers, it usually occurs a little bit later than in the big cities. So I believe, although sometimes it's difficult to accurately predict, that you're going to start seeing a gradual increase up and up and up, and you will probably peak later and come down a bit later than what we're seeing in the bigger cities like Los Angeles, San Francisco, New York, and Chicago. But you're not going to be able to escape from the fact that many people will get infected. Now, fortunately, on a case-by-case basis, Omicron appears to be less severe with regard to hospitalizations and deaths. However, the sheer volume of the numbers of people that get infected means that even though on a person-by-person basis it's less severe, there are still going to be a lot of people in the hospital, and some, usually the elderly or those with underlying condition, and particularly among the unvaccinated, are going to get into serious trouble. And that's the reason why in rural areas, particularly those areas that don't have the healthcare capability of the hospitals with intensive care units, it could stress the hospital and the healthcare system. One of the best ways around that is to try and get through this. If you're not vaccinated, please get vaccinated. If you are vaccinated, get your booster shot. One thing we've learned very clearly, that as bad and as transmissible as this Omicron variant is, the booster shots do very, very well in protecting you against severe disease. In fact, if you look at the people who are in the hospital with severe disease, the unvaccinated and unboosted have a much higher level of severity than do the vaccinated and boosted people. So that's the thing we want to do, as well as the normal public health measures, that if you're in an indoor setting, a congregate setting with a lot of people that you don't know their vaccine status, to wear a mask, because we know for sure that masks not only help protect you, but if you happen to be infected and don't even know it because you have an asymptomatic infection, it prevents you from spreading it to someone else who might actually get a severe outcome from the infection.
Well, that would lead me to my next question. We're hearing reports, that the cloth masks are no longer that effective against Omicron, and that you need to get those N95 masks. Is that what we're seeing with this Omicron variant more?
It's a gradation of effectiveness. If you look at I think the principle, or I know what the principle that the CDC says, it's better to wear any mask than not wear a mask at all. So some people say, well, I can't get a high quality mask, so I won't wear a mask. That's a mistake. Clearly, the N95s, if they're well fitted and they fit well and you get comfortable enough that you can wear it, is the best possibility. Next is a KN95 mask. Not yet as effective, but very, very effective. Then you work your way down to a surgical or double and triple ply mask, and then you get to a pure cotton mask. Each of them have some degree of effectiveness. The cotton masks, the cloth masks, may not work as well as an N95, but it's certainly better than no mask at all. So the advice is, get your hands on a mask that's the highest quality, that fits well, and that you could tolerate wearing. I myself, I wear a KN95. It fits me well. I could wear it for a long time, and it works well for me.
Now, we have a lot of farmers when we talk about vaccines, they say, hey, I'm on the farm by myself a lot. I have very minimal exposure to the public. What kind of a message can we give to those people that say, hey, I'm not going to town that often. Why do I need to be vaccinated?
You know, particularly with Omicron, we're seeing people who even try very hard to avoid getting infected are getting infected. Now, if you're a healthy, strapping young farmer, the chances of your getting a serious outcome are very, very low. But what you might inadvertently do, innocently and inadvertently, is get infected. You may have no symptoms at all or minimally symptomatic, and then accidentally, as it were, without even knowing it, spread it to someone you care for, an elderly parent or grandparent, or someone who has got an immune suppression due to cancer chemotherapy, or a child who has an immunodeficiency. Nobody would want to do that. I'm positive that no one would want to feel that they're spreading it to someone that's causing that person suffering and maybe severe disease. So there are a couple of reasons to get vaccinated, not only to protect yourself, because you can't guarantee that you're not going to get infected or you're not going to get a serious outcome, but also you want to be part of your communal and community responsibility to prevent the infection from spreading throughout your community.
Now, we see it more in rural America, but we are seeing it in urban America too, the resistance to the vaccine, whether it's the information they believe or the fear of what's in it and how fast it was rolled out. I mean, what kind of assurance can people in rural America get? Is it a matter of sitting down and talking with their trusted family physician and talk to them as well? Or what kind of research can they be doing?
Well, you make a very good point. The easiest way and the best and most effective way to get people to get vaccinated is to be speaking with a trusted messenger. That could be your family physician. For your children, that could be the pediatrician. That could be a clergy member or someone you trust. Because if you look at the data and you're only asking people to look at the facts, not the misinformation or the disinformation that you sometimes see on social media, and that is, this vaccine has been given to billions and billions of people throughout the world. It is shown to be highly effective and very safe. And when you say, well, the reason it took a short period of time to prove its efficacy is that we were doing scientific work for decades before that led up to our ability to develop a vaccine very quickly. No corners were cut. No safety was compromised. It was done in the proper way. And now, if you're looking at it, more than a year past the time, I mean, the vaccine began to be rolled out in 2021. You have over a year's worth of experience with the vaccine. Right now, it's shown to be extremely safe and extremely effective. And that's the reason why you really want to see that if you can get people to understand why it's for their benefit, that they should go get vaccinated. You know, we started vaccinating people in the December 2020, January 2021, and we've gone through an entire years of experience. And there's no doubt that if a person is vaccinated and boosted, the chances of their getting seriously ill compared to an unvaccinated person is very low, very low.
So I've got two more questions for you, Dr. Fauci. First one, do you foresee us eventually getting to a place where the vaccine could be something similar to the flu, where you just go get your shot and you kind of can relax about it?
That is entirely conceivable. I'm not so sure we'll need to be vaccinated every year. I hope not, but if we have to, so be it. As long as it's protecting you, it's a much more effective vaccine than influenza vaccine. That I think people need to appreciate. The efficacy of this is 93, 94, 95% effective. So it's one of the most effective vaccines. Maybe it'll have to be every couple of years, or maybe it'll have to be every year. We don't know that right now. We just have to see how things play out.
And the last question I have for you is, obviously there's been so much work done on prevention and information about the vaccination and stuff, but from a personal standpoint, I had a situation with a family member who had COVID, went through the quarantine time, was cleared to return to work. 4 days later, had a medical issue as a result of the effects of having already had COVID. Weakening of blood vessels led to a stroke. The doctors in the hospital that we dealt with were saying, I wish there was as much effort put forth into helping people understand what's going to happen in their lives after COVID. Are we seeing a way to get more and more of that information out as we're getting more details about life afterward?
Oh, Dustin, that's an excellent question. And in fact, the US government is putting about $1.5 billion in trying to study and studying cohorts of people who have recovered from the acute phase and now have lingering signs and symptoms, some quite severe, and sometimes it lasts for weeks to months. It's referred to as long COVID, is what the name of it is. It's a more detailed name, but the one that people use the most is long COVID. And we have cohorts of thousands and thousands of people we're following to try and find out what the pathogenic mechanism of how people, when they recover from COVID, still have the persistence of some serious signs and symptoms. So we're learning a lot about that.
All right. So last thing I'll let you wrap up with is just one more message for our people in rural America, rural Iowa, about the situation we're in as we find ourselves today in January.
Yeah, the message is that we're in the middle of a very severe outbreak of a very transmissible virus. Please get vaccinated. If you're vaccinated, please get boosted and try and stay safe by avoiding crowded situations and wearing a mask.
Well, Dr. Fauci, I thank you so much for taking the time to visit with us here today.
Thank you very much for having me, Dustin. It's a pleasure to be with you.
That's Dr. Anthony Fauci here on the Iowa Agribusiness Radio Network.